Age-related macular degeneration is a condition that affects the center of the back of the eye, called the macula, an area important for reading and fine vision. And in this condition, in the commonest form, the macula develops waste buildup under the center, so-called early dry macular degeneration. And if we all live long enough, the waste buildup can cause worn-out patches in the macula called late dry or atrophic macular degeneration. In addition to this underlying process, some eyes, but not all, can develop a sudden growth of blood vessels in the macula that can leak and bleed. And this is called wet macular degeneration because the blood vessels leak fluid and make, in inverted commas, the macula wet. And that can cause a sudden drop in vision. For the wet form of macular degeneration, we have some reasonably effective treatments, which are medicines we put inside the eye that block the growth of blood vessels. However, we don't have proven treatments yet, but we are close to some treatments for advanced dry macular degeneration. The stem cells are very exciting potential treatment in the future for AMD. We know that the cells under the back of the eye, like the brain, later in life cannot heal or repair themselves. And with late dry AMD and certain aggressive forms of wet, we don't have established treatments. The hope is with surgical techniques, we can deliver more normal cells in the back of the eye. At this point in time, the only trials available can only replace one type of cell called the pigment epithelial cells, but not the other types of cells that are often damaged as well. So at this point in time, stem cells are only available in research trials for very specific forms of AMD and not all forms. But we hope with further developments, this can be a clinically useful treatment. So there are a number of different laser treatments that have been used for the last 30 years for age-related macular degeneration. Before we developed the injections for wet macular degeneration, we had hot laser treatment, which is destructive and has been replaced by the injection treatments for wet AMD. However, there are some forms of wet AMD called polypoidal lesions that are more common in Southeast Asia. There's also in the Western countries as well, where argon laser or a form of laser called photodynamic therapy may be an effective treatment choice. In addition to those treatments, there are some other forms of laser that may have potential to help patients with forms of dry macular degeneration. And the two forms of laser are what's called photobiomodulation and a very short laser pulse that is less destructive to the back of the eye. The photobiomodulation is a very specific wavelength of light that has been used in various studies for 50 years that in animal models and laboratory work seems to affect the way the cells in the back of the eye function. But as yet, we don't have robust trials to say definitively whether they definitely prevent visual loss in the medium to long term for the patient or not. And also, although there are encouraging results, it's not something we can definitely recommend for all patients. Another form of laser is the very short wavelength light type of laser, which has gone through some really robust trials from our colleagues in Australia that overall showed no benefit, although it may be that certain types of dry macular degeneration may benefit, provided they don't have particular forms of dry where they have what are called reticular pseudodrusen. But further trials may help define this better. There have been a number of trials to try and deliver drugs to the back of the eye using drops. Part of the problem is trying to get a good enough dose from a drop in high enough concentration to the macula, as it has to either pass through the structures inside the eye or travel around the outside of the eye and then penetrate the macula. And there has been a number of trials of drops that may reduce or partially replace the need for injections, but to date we haven't had success. But there will be further ongoing trials to achieve this. So we have two new treatments that have been, we hope will have either just been licensed or hopefully will be licensed by the end of the year. The first is a new drug to treat wet AMD called faricimab that is the first injectable treatment that goes beyond simply blocking vascular endothelial growth factor, or VEGF, which is the main cause of blood vessel leak. And this new drug blocks two types of chemicals that can cause blood vessel growth. The research trials show a slightly improved benefit in terms of longer duration than conventional treatment, but not necessarily a better outcome. But given that most of the reasons we don't get great outcomes in our patients is the burden of treatment and the frequency of treatment, I'm hopeful that the introduction of this new drug will lead to better outcomes for patients in the real world. The second ray of hope is the results of clinical trials for the first drug that shows potential benefit for preventing late dry macular degeneration from getting worse. And these are complement inhibitor drugs that can slow down the enlargement of the worn out patch. The results of a phase 3 trial from a drug from a company called Apellis was positive in one trial and positive when both trials were combined. And we are waiting for potential approval of that drug by the end of this year. And there are other drugs from other companies in phase 3 trials blocking other parts of the immune system. So there could be a major breakthrough, we hope, with an approved drug in the next 12 months to treat a currently untreatable blinding form of the condition called advanced dry or atrophic macular degeneration.